It's another day with the physicians where your health is our business.
With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the Planet Ultra of your regular program. Back pain is a common presenting complaint associated with a wide range of acute and chronic medical conditions. The prevalence rate for children and adolescents is lower than that seen in adults, but it is rising. Back pain commonly stems from strain, tension, or injury. The main symptoms of back pain is an acute or pain anywhere in the back and sometimes all the way down to the buttocks and legs. On today's program with the physicians, our experts will give us more information on back pain. Don't go away. Yes, it's another day with the physicians where your health is our business on your regular program. My name is Dr. Martina Agberie, and with me is my regular host. My co-host is
Dr. Memuna Yusuf Kadri. Do remember that your health is our business on your favorite health TV talk show, The Physicians.
Yes, we're talking about back pain, backache. And during the introduction, I did mention that it's usually more common in adults, but now we have children and adolescents having it on the increase.
It's not a new thing with the pandemic and online schooling and more screen time. Aside from that, because the next question will be, not every child has access to TV and all that, but again, they were restricted. A lot of children weren't playing or running around the way they were running around before, and their activities were also kind of a bit restricted. So even if I may not be aware of the global changes, but at least within this pandemic, a lot of kids are also complaining about their back.
I think because of the way they usually would stay at home. That sit at home that was really compulsory.
It was compulsory.
It was compulsory. Yes. And again, for adolescents, could we actually ascribe it to the fact that they now wear 6 inches shoes and all those things? It may be related to.
It could be. There's nothing, when things like this come up, there's nothing you rule out. Some things that we may not even know. When the expert comes, I'm sure there are certain things they will even highlight for parents especially and teachers to also know this could be the reason. Yes, shoes could be the posture and so many other things.
One other thing that I noticed for adults, when you start aging gradually, the next thing is my back, this ache, this thing there. Well, after 40 years,
no, our sitting position, do not sit the way we are sitting now.
This is actually,
so the thing is that we have to sit, but it has to be a conscious effort that, sit upright. Yes. But most times, before you know it's happening,
slouching. Well, I don't know. Have you had it before? Back pain.
Back pain is it's as if it's a part of who you are, whatever part of you as you grow, if you are driving, you are being driven, if you are standing, you are sitting.
Anyway, I don't think there's anyone who hasn't had a backache before, a back pain, and when it gets really bad, you find yourself seeing the orthopedic doctors. Anyway, we'll be back after the short break. Don't go away. are just joining us, you are on to your regular program, The Physicians, where your health is our business. Today we'll be talking about back pain, the symptoms, presentation, risk factors, and possible complications, and of course, management. With me in the studio, we have a consultant orthopedic surgeon from the Cedarcrest hospitals. He is no other one than Dr. Bolarinwa Akinola. You're welcome to our program.
Thank you very much.
Nice having you again. You're looking really
absolutely.
good. COVID, you're looking really good.
Yeah,
Well, yeah.
you're welcome.
This is
with
the
the
COVID
Yeah,
look.
this is a COVID
Exactly.
look, huh?
The COVID look, yeah,
This
yeah.
COVID
You look
Yeah.
good. Okay, we're talking about the back pain. Let's start with the prevalence. Because when we talk, said something about the prevalence, adults, adolescents, children.
Yeah.
What really is the prevalence?
Well, thanks for having me, Dr. Martina, Dr. Kadiri. It's always a pleasure to be here. Just to say that back pain is very common in adults. Not as common in children, but it does happen in children as well. And it is said that up to 90% of adults will have back pain at some point in their lives. So what tends to happen is a lot of those incidences will be short-lived, will be kind of acute for a short period of time. They will get better, and then they forget about it. A few months down the line, a few years down the line, they might have another incident. But you then have a subset of people, maybe about 20 to 30%, who will go on to become chronic back pain sufferers. So generally, most adults at some point in their lives will experience back pain, but only about 20 to 30% of the adult population will continue to experience some amount of constant back pain, which then becomes a chronic sort of back pain.
Okay,
Yeah.
so
But
what are the risk factors? What actually is responsible? The risk
Yeah.
factors and the possible causes.
All right, so in terms of the risk factors, so definitely age is a risk factor. As people get older, the spine and the spinal column, the structures around the spine, they start to degenerate as well, and that can predispose to back pain.
Is something like this?
So I have a spine model here. So my spine model is composed of bones. So those white things are the bones, and those blue things are the discs in between the bones, and they act like shock absorbers in between the bones. So what tends to happen is these shock absorbers start getting smaller, start getting dehydrated. They're not functioning as shock absorbers as much anymore. And remember that in the joints of the spine, you also have the ligaments joining the bones together. After a while, the ligaments are not quite as firm and supportive as they should be. You also have the muscles attached to, I mean, obviously you can't see the muscles here, but you have the muscles attached, and they have tendons attaching to the bony spine as well, and those also become a bit lax. Sometimes people are not as fit as they should be. People get obese, their abdominal muscles are not very strong, their back muscles are not very strong. So the whole of the back complex, doesn't support the weight as well as it should, and that predisposes to back pain as well. So it's factors like age, factors like obesity, factors like there's a big genetic factor to back pain. Some people are just predisposed to having more back pain than everyone else. There are some skeletal deformities that can predispose people to back pain. So for instance, if you're born with if you have scoliosis, which I'm sure at some other time we will have some time to talk about that. If you have scoliosis, it is said that people with scoliosis have more back pain, generally speaking, compared to the general population. So things like that could predispose people to having back pain.
I have a three-pronged question for you.
All right, okay.
First is, do we have gender differences to back pain? That's one. The second is, we are still within the pandemic. How has that made more people visit you and your colleagues more within this pandemic because of the sitting, online, sedentary lifestyle and all? And the last one is, aside from the risk factors, what are the causes of back pain?
Okay, thank you very much for your questions. So first of all, are there gender differences? There are possible gender differences, but they're not, I won't call them real gender differences. I think they kind of compensate for one another. So for instance, anatomy is important. So if you look at the spine model, you can see if you're looking from the front, it looks like the spine is straight.
Yeah.
But if you actually look at the spine from the side, this is the lower back. This is the region at the lower back just here. You can see that there's a curve to the lower back. and this is called the lumbar lordosis. That's the anatomical term. Some people, especially in women that have big buttocks or big behinds as they call it, the lumbar lordosis could be more exaggerated.
Okay.
And that exaggeration can predispose those particular women to having more back pain just because of their anatomy. On the other hand, manual laborers, people who do a lot of heavy lifting, who are mostly men, they could also be predisposed to having more back pain because of the activity of lifting heavy things, having to bend down constantly all the time. So in terms of gender differences, I don't think there's much of a gender difference. I think depending on occupation, so that's the other risk factor I haven't mentioned, occupation as well. So depending on your occupation, depending on your anatomy, different subset of people could be predisposed to back pain. So definitely a sedentary lifestyle does not support so much the prevention of back pain. And then the third question, what are the causes? It's a very difficult question to answer because if you have 100 people and you investigate those 100 people for back pain, so 100 people come in here with back pain and you investigate them for back pain, you might not find more than 10-15% of an actual cause that you can say this is the reason why this person is having back pain. And some of those causes are some of the things that I, as a surgeon, as an orthopedic surgeon who sees a lot of back pain patients, those are the things I want to make sure I'm not missing. So things like infection. Does this person have a disc infection? Does this person have tuberculosis that has gone to the spine? Does this person have a discitis? I don't want to miss that. So I'm thinking to myself, could there be infection? Number two, has this person had a trauma? Have they broken their spine? Do they have a fracture in their spine? That's a cause of back pain because they have a fracture. Number three, do they have a tumor? Do they have cancer that is affecting their spine? That's another thing I don't want to miss. But those actual causes that you can put your finger on, they're not very many. And they don't happen as often. Most back pain that happen, we tend to call them mechanical back pain. And it's just a failure of this musculoskeletal framework where you have bones, discs, ligaments, muscles, and there's just a poor coordination with all of those mechanisms. That's what tends to lead more to back pain. The other aspect of back pain that we can find a cause for is back pain that is associated with leg pain. Because most of the time, that's what people call sciatica. Sometimes, and it could be due to so many reasons. Most of the time, when you have leg pain together with your back pain, it's because, and that's the other thing I need to say, a lot of people call the back, they call it the spinal cord. The back is not actually the spinal cord. The back is the spine. This is the bony spine. But inside, this bony spine acts as a cage for the spinal cord. So if you look from the side, you can see the hole on the side. So within this enclosure, the spinal cord runs in the middle of that hole.
Where does the cord come from?
So it comes from the brain.
So it's a part of the brain.
Yeah. So it comes is a continuation of the brain. It's the spinal cord is the structure that carries the nerves from the brain and brings it down to the rest of our limbs and our abdomen, our organs, and our abdomen and everything. So that's what the spinal cord does. Just the last bit, just before I close, on the sides now of this, as the spinal cord comes down, you can see these holes on either side coming down. Each individual nerve comes out on each from each hole from the side holes. So yeah, so
it's getting very, very interesting. Back pain, backache. Now you already talked about the spinal cord and the housing, the extension of the brain.
Yeah.
Talked about the nerves and everything. So they will know where the challenge is.
Yeah.
It's getting very interesting. Just hold it.
All right, man.
My viewers out there, I'm sure you're enjoying it the way I am also enjoying it. We'll be back after this short break. Let's keep a date with the physicians outside. Just stay tuned.
But as a teacher, one of the things that could cause back pain is carrying bags or materials or teaching aids and putting at your back.
I'm an ex-civil servant. It's because when I sit down more than 1 hour or 2 hours, I must feel pains.
This back pain, I don't get on before. But this back pain, They happen with everybody.
No, I've never had back pain.
You say small boy we have pains, back pain. It's from old one now.
That thing, be like say the old man and the medium side, the young boy, they get this country.
Old ones are people that normally have back pain.
I go for the orthodox. But at the same time, I don't rule out the use of alternative medicine.
Some use agujedi pie, say it's back pain. Some will go to doctor, they will give them medicine.
I go no go pick you back here.
Of course, what we eat and drink can also cause back pain.
For some people, but me I don't believe in that.
If you drink too much, it will make back pain. That almost, especially that sugar something.
Yes, too much sugar can cause back pain. The advice I have for them is that they should not be carrying too much load.
Our back is our strength, and that's we shouldn't toy with our back.
In the night, eat before night, and then drink a lot of water.
Making them know what they go eat, not be say go to eat anything.
Welcome back. If you're just joining us, you're on to the Physicians Where Your Health is Our Business. We're talking about back pain. And Dr. Bolarinwa Akinola, a consultant orthopedic surgeon, been doing justice to this particular topic. You talked about the spine, okay? And the functions, what it does. And of course the extension of the brain. Then you talked about the nerve. Is that where, because when people are aging, why is it that they now have more of back pain?
All right, thank you very much. So the whole of any part of the body that has joints will naturally undergo degeneration. It's part of the aging process. So that's why more older people have knee replacements, more older people have hip replacements, because those joints, they get wear and tear. Sure.
Of course, the next logical question to ask is that, okay, we talk about this back pain, so how do we now take care of it? Doctor, tell me what I need to do to make me feel better.
Like
how do I
treatment?
treat it? How do I manage it? So, because it's nice you tell me what it is, but the how to manage it is now
absolutely
the most important.
So the management will derive, of course, from the risk factors, from the causes, and that leads on to management. Most back pain patients will be managed non-operatively. I think that should be quite
you need to know
good news for a lot of people, that most back pain sufferers will be managed non-operatively. Even for those who are having leg symptoms, even for those who are having some impingement on the nerves, many of them can be managed non-operatively. And so the non-operative management will consist of, so as I said before, there are a lot of people who experience back pain. It just comes, stays for 2 days, gets better, and then it never really happens again for some time. So one of the things that people can use are anti-inflammatory painkillers, like ibuprofen. When the pain comes, you use an anti-inflammatory and it settles things down, you get better. But by the time the pain starts to persist, then you probably need to use something a bit stronger. So you have to go on to maybe some opioid analgesia. Of course, see your doctor, see your specialist. So analgesia, starting from paracetamol to anti-inflammatories to opioids to muscle relaxants, because many times when the back pain starts, the muscles go into spasm as well. So muscle relaxants can help. The second thing is physiotherapy. Physiotherapy for me is a very, very, very important part of management of back pain, because what it does is it deals with the acute pain using their pain modalities, but it also teaches you exercises that people can do at home. Most back pain patients can be treated non-operatively with painkillers, getting generally fit, doing exercises and physiotherapy.
Okay, for back pain that is not well managed, can it lead to disability, and are there possible complications?
So thank you very much. That's a very important question. So yes, so back pain, so chronic back pain that is not well managed with proper exercise and physiotherapy, yes, can lead to disability. It can lead to disability because this person is constantly in pain. It affects their mood, it affects their well-being. They just, it just cripples them.
Speak to our viewers what they can do right now as a self-help tips they can,
Sure.
you know, start adjusting to rather than waiting for anti-inflammatory, analgesics and all that, because some people are actually watching you now, they're like slouching or they're doing something.
So we want to start with the proper way of sitting.
Absolutely. So the trick really is to try and keep your spine as straight as possible. Any activity you're doing, whether you're sitting, whether you're standing, whether you're bending. So if you don't mind if I demonstrate, when people want to pick things, a lot of people just go like that to pick things. That is not very good for your back. What you really need to do to pick things is to go like so and pick what you want to pick. Okay. You're maintaining your core, all right, and you're keeping your spine straight. So even if you're picking something a bit heavy, you're maintaining your core well balanced, you're keeping your spine straight. That really helps the health of your spine.
Most of
If you're not physically fit, how you want to do that?
Well, then you call for help. Ask somebody to help
you out. Yeah.
Absolutely. The other thing, of course, is manage your weight. Managing weight is very, very important for almost every health condition. Yeah. Managing your weight, keep your weight down. Do exercises, abdominal exercises, because your abdomen supports your spine as well. So if you can get a six-pack, then that's ideal. So the more you can
to your
keep
fellow men, it's not women that are calling six-pack, but the men.
So the more you can keep your abdominal muscles strong, the more you can help it. But even when you do all these things, there will be times when you need to take the painkillers. There will be times when you need to get the paracetamol, the ibuprofen, just to help the pain. But what I would say is, if you've used simple painkillers, if you've kept yourself as healthy as possible, 3, 4, 5 days down the line, the pain is still persistent. Please see somebody. Please see your doctor.
Wow, wow. The time is never enough when we have you as a guest, Dr. Bolarinwa Akinola. Thank you so much.
Thank you so much.
For in fact breaking it down. Because it's actually an ache. Back pain is an ache. It's very disturbing, and you know, when you think about it, aging actually becomes very scary, because it looks like it comes with age too, whether you want to avoid it or not. But thank you so much again for coming on our program, and our viewers out there. I'm sure you benefited from what the consultant just talked about, back pain. The things that you can do. First and foremost, you must try and sit upright. Don't slouch. Sitting upright is very, very important. Don't go bending to pick things from the floor. You must go down systematically. You saw the demonstration that he made in the studio, and lift whatever you want to lift. But don't go lifting weights that you think will put more strain on your back. Floor is also very good. Orthopedic mattress is good, but if you can't afford that, try and lie flat on your back if possible. Then the floor is also very, very good. It's natural. Now, of course, with age, it comes with age. So you must try as much as possible to do your exercises regularly, to keep fit, so that you can prevent and live a well-balanced life in future, not coming down with aches. And if you have pains and you're unable to manage them, please go see your doctor. And of course, eat healthy.
Please ensure, keep safe, do the right thing. Your health is paramount to us, and that is why on the physicians, your health, of course, is our business. I remain Dr. Memuna Yusuf Kadri. Until next time, stay blessed.
And I'm Dr. Martina Agberie. Don't forget to follow us on our social media handle, Facebook, Twitter, Instagram, and of course, YouTube. If you haven't been watching some of this episode, the past ones, you can actually get a lot of them on our YouTube channel. Ensure that if you want to be part of this program also, you are just a handle away. Just click and send us an email. Till next time, stay blessed.